The target for a medical treatment to be about the size of the tip of a pencil. It's something Dr. David Quintana from Austin Radiological Association faces every day. He's here to break it all down and how that works exactly. Thanks for being here.
Thanks for having me.
So we're talking about interventional radiology, correct?
Also considered IR, yeah.
IR, good. That's a lot easier. Let's call it IR. So what exactly does that entail?
So interventional radiology essentially reaches the source of a medical problem through small blood vessels or a tiny incision into the skin.
Wow.
And we use that to directly guide treatments directly to the patient.
Mm-hmm. So why is it something a patient should choose or seek out?
So as an interventional radiologist, we focus directly on patient care. We're intimately involved in their care. So treatments before that were required, that might require surgery,
right.
Now we can offer minimally invasive treatments.
And that's what everybody wants to hear, right?
Right.
So can you elaborate a little bit more on that technique and how it's done? Because it sounds like it has to be so precise.
Sure. So interventional radiology, so everyone sort of knows, not everyone, but a lot of people know what radiology is, right? CAT scans, MRIs. Those are pictures of the body that we use in different forms to look inside the body to see what's going on inside.
Right.
What interventional radiology does is we use those sort of techniques to help guide treatments and help do them safely and as minimally invasive as possible.
So let's take a look at a specific example if we can. I know we have some photos. Can you help describe what we're looking at here? Sure.
So this is a middle-aged gentleman who outside of his liver disease, he has cirrhosis, which is a liver disease, is otherwise healthy. And this is an image of the right side of the liver, and you can see that dark spot on the left side of the screen.
Yeah.
Is a tumor in the liver.
Oh wow.
And so what we would attempt to do is it's not resectable. It's not something that the surgeon can take out. So what we would attempt to do is try and target that lesion. And so we can use an angiogram to help guide a catheter. You can see here there's an angiogram here where we have a selected image into the liver, and you can see the tumor enhancing in this picture. We subsequently did a special picture to sort of get really close and see exactly the enhancement pattern of this tumor. And you can see here we really are far out into the tumor and have selected it out very precisely.
Yeah.
And then we can deliver a treatment that is directly only to that tumor, minimizing the effect to the surrounding normal tissue. This is a final image you can see here where the treatment is directly involved into that tumor, and there's very little treatment that is outside of that tumor.
Right.
So it's something that we can target directly tumors and different things and minimize the effects of the surrounding normal tissues.
Right. Well, that's really great. Thank you for sharing all that information with us.
Yeah.
So if people want to just find out more, they can head to ausrad.com, and you can follow along on social media as well. Appreciate all that great information and the work that you do.
Thank you. Thanks for having me.
All right, Jordan, what's going on out there?
Well, we've got a special guest. We've got